Good evening. This is CTV News for Tuesday, January 24th. I'm Patricia Vallone.
And I'm Denise Douglas. Thank you for joining us this evening. Police are looking for a gunman who shot a woman at a school bus stop this morning. Authorities say around 7 a.m. a suspect approached the woman at the intersection of Chester and Winthrop Streets in Oxon Hill. They fought, and the man pulled out a gun and shot the victim. 6 children were waiting at the bus stop at the time.
Domestic violence situation. This is a domestic related shooting. We can't say that. In cases that are domestic related, we have to do everything that we can as a law enforcement agency to protect the identity of the victim. So we're unable to say whether any of the 6 children that were standing at the bus stop were indeed any of her children. At the time that the gunshot rang out, the children did run away from the bus stop scene. As to where they went, it's not, that information hasn't been shared with me. We do know that all the children were accounted for.
And the children were not hurt. We're also told anyone with information on this incident is asked to call police.
Governor Larry Hogan announces new measures to combat a growing heroin and opioid epidemic, a problem that resulted in 1,400 fatal overdoses in Maryland last year. Among his initiatives, Hogan plans to introduce legislation that would limit the amount of opioid medications prescribed to a 7-day supply, with an exception for cancer and hospice care.
From one end of the state to the other, know the devastation that heroin and opioid abuse can cause, and it literally is tearing apart families and communities. I personally, many people in the room probably have some friend or loved one or family member that's been touched by this. I lost a first cousin to this terrible disease.
We are introducing the Prescriber Limits Act of 2017, which will limit the duration of prescription opiates prescribed upon an initial consultation to 7 days of supply. This policy has been pursued by a number of states, including Massachusetts, and recently the Center for Disease Control issued guidance supporting these types of duration and dosage limits.
Now, Hogan also promised legislation to boost the penalty for dealers whose drugs cause fatal overdoses, with an exception for those who sell the drug to sustain an addiction. Another bill would allow the state to take action against drug prescribers and dispensers, and an executive order establishes a central command center to combat opioid abuse. Well, Maryland Delegate Derek Davis says the state is taking action that could threaten the viability of cardiac care at Prince George's new regional hospital. Davis says the recent approval for a cardiac unit at Anne Arundel Hospital will jeopardize the viability of the new Prince George's facility by potentially pulling patients away from Prince George's. Davis is asking citizens to call or write the Maryland Healthcare Commission and ask members to stop the move. Well, I still have some health care, and how will things change, and what is next? These are just some of the questions that people have been asking now that President Trump has issued an executive order to dismantle the Affordable Care Act.
That's right, Patty, and joining us right now to answer some of those questions and discuss this very pressing issue is Sherry Curtis with the Department of Social Services. We've been hearing a lot of concern. What have you been hearing?
People are near panic. They're very fearful because of what they're hearing in the media. And what we've been doing in terms of our program at Prince George's County Health Connect, we're the agency responsible for doing the enrollment under the ACA, is trying to, calm down some of the fears. I mean, things will really take a little bit of time. And even with the executive order in play, our message is clear that we want people to get enrolled, and as many people to get enrolled as possible.
And is it too early to tell, but do you expect to see some major changes with the ACA?
I can't even imagine that any changes would happen in this fiscal year, just because of the cycle of how budgets run and what is already in play. There may be some pieces, you just don't know what you don't know. The executive order basically charge the departments and the agencies to take a look at how they could diminish some of the mandates. And while there's some specific requests in there, they still have to see what they can do within the law. And then if there's any additional changes, it's going to require an act of Congress to change the law.
You mentioned that you're trying to calm people down, letting them know things will be okay, but what specifically are you doing to sort of calm those fears? And also, it sounds like people will still be covered under the Affordable Care Act for some time.
I believe so. I mean, and just because we are boots on the ground and working with the community, we just want people to understand the importance of being covered. That the one thing we don't want people to do is risk themselves in any way or have any situations where they're not covered and they can't be. I mean, the law is still the law. If you're not covered, you're going to have the tax penalty until they pull some of that back. I think that what we believe in Prince George's County, that it's important to get covered and get seen and get healthy. I mean, that's our mantra. And what we want people to do is understand that there's only a few more days in order to get 2017 coverage. And you know, it's sort of like the old adage, if you're in and you're already in, then even if there are changes, the people that are in are going to be probably less impacted than people that are not in at all. And so we just want to encourage everyone to get covered. The commercial health insurance enrollment period ends January 31st, but Medicaid is year-round. Maryland has expanded Medicaid. If there's people out there that are laying on the couch and don't believe that they're eligible for health coverage, they need to check it out and find out if they're eligible, because we want everybody covered. And you know, that's pretty much our message. County executive is very concerned because ACA has really helped a lot of people in Maryland, particularly in Prince George's County. We've enrolled 175,000 people or more in the past 3 years that many did not have coverage at all. And so we're encouraged by trying to improve health outcomes.
What are you trying to do to get the word out to get people to sign up?
Well, we have multi-tier things going on. The state, of course, does their own marketing, and then we have, you know, things in the movie theaters. We've got radio ads. We've got all kinds of activity. We have people that are working in agencies. We've got a number of partner organizations working with us. All the agencies are working with us, and it's interesting that now that this is the hottest topic in the nation right now, even more people are coming in and wanting to join, and we're seeing an uptick in people that are interested in getting enrolled because they do believe they need to get in. You know, I think the people that are most fearful are the ones that already have coverage and may fear that they would lose their coverage.
Okay, still a lot more to go on this story. We'll be hearing a lot more about it in the near future.
You
I'm
will.
sure.
I just wanted to make sure that if anybody has any questions, that they call 301-927-4500. And if you can post that later, because that's our call center. And if people need to know where they can get support.
Can you repeat that number one more time?
301-927-4500.
Okay, thank you, Sherry. And we will also give folks the website information that they can check that as well. And the number is pgchealthconnect.org. pgchealthconnect.org. You're watching CTV News. I'm Denise Douglas.
And I'm Patricia Vallone.